When you choose to have your spinal condition addressed at the Orthopedic Institute of Ohio, from diagnosis through conservative treatment or surgery, and finally through therapy and recovery, you can expect a comprehensive process and state-of-the-art procedures to rejuvenate your quality of life.
I get a lot of questions from people who have concerns about their spine. Ready to get this over with?
Yeah, you betcha. I just want to be able to walk after this.
One of the most important questions is, what are the risks of surgery? Am I going to be paralyzed? That's normally a big fear of patients who have spinal operations. And the actual paralysis rate for spine surgery is virtually very, very small. Especially if you operate on the lumbar spine, it's virtually zero. So if a patient comes in, then my goal as a spine-trained physician is to convince them that what they have is actually treatable and it can be done safely.
From state-of-the-art CT and MRI imaging equipment to hands-on analysis from an award-winning orthopedic surgical specialist, OIO's spine diagnosis process is the very definition of comprehensive and thorough.
So if you come into OIO with a spinal condition, a treatment plan will be designed to best solve your particular problem that you have.
OIO offers a diverse variety of orthopedic care alternatives. With a thorough diagnosis, you'll find out if non-surgical conservative therapy is ideal for your condition.
Conservative care is any treatment modality that doesn't require an operation. So it may be simply an epidural steroid injection, physical therapy, or sometimes just pain management in terms of pain medication that we provide for the patient, versus surgery, which is not conservative.
Adjacent to the Orthopedic Institute of Ohio, the Institute for Orthopedic Surgery is a unique private hospital with access to 15 of the finest orthopedic surgical specialists in the world. Out of 9 hospitals in the region, IOS is rated #1 in patient satisfaction, sustaining the highest scores in patient satisfaction for several years and counting.
The unique thing about OIO, when you come in, if you need surgery, you go to the next phase and you can literally walk over next door to get your surgical care. A patient who has failed conservative treatment, let's say for example they have lumbar stenosis pain in their legs, then we offer that patient surgery. And surgery may be simply just decompression where we just remove the pressure that's creating the pain, or it may require fusion if the spine is unstable. And if you go into surgery, you should expect that surgery that will be done very safely and very effectively. The scoliosis surgery is a maximum invasive surgery. It requires a lengthy surgical operation, anywhere from 4 to 6 hours, sometimes 8 hours. But generally, the patients do very well in terms of post-operative outcome. Their blood loss is usually minimized by different techniques that we use in the operating room, as well as they have great analgesic afterwards where their pain is actually essentially manageable. With this particular scoliosis deformity surgery, post-operative recovery is actually excellent. The outcomes are rated between 85 and 90% success rate. This is my specialty, this is what I do, this is what I specialize in and what I offer here at OIO.
For your conservative therapy or surgical recovery, the physical therapy unit has been expanded throughout a 6,200 square foot addition to the OIO facility, with a complete staff of full-time licensed therapists and equipment upgrades to speed your recovery.
The goal of a spine operation when you have a surgery is not to sit in bed. So the goal is to get you moving, get you up, and get you back to work.
Ask Dr. Sinclair and his staff for even more specifics on your OIO process and procedures, your course of treatment, and your recovery. You've chosen the best. You chose the Orthopedic Institute of Ohio.